around.
You want it on?
Nice and bright. Okay, let me know when you're good to go.
Rolling.
Okay, well, it's wonderful to be here at Bray Park State High School with the local member, Nikki Boyd, once again celebrating the number of people coming out getting vaccinated at our schools. We know that they've been such a success in the past, and we'll have even more schools open next weekend for another Super Schools weekend. But we have about 58 schools that are doing vaccinations this weekend, and if you haven't had your vaccination yet, jump online and have a look at the school closest to you. Now, I have wonderful news, and that is that we've had 0 new cases overnight. So that puts us at 19 active cases. We've had 9,212 tests. So please keep coming out and getting tested if you have any symptoms whatsoever anywhere in Queensland, but a particular call out for the Gold Coast, because of course we still have those cases unlinked on the Gold Coast where we want to identify if there is anyone else who are moving around the community who may have the virus. So if you have any symptoms, no matter how mild, please come out and get tested today. And great vaccination numbers. We've had 17,227 vaccinations in the last 24 hours again. So that's 3 days in a row over 17,000. And what that shows is that the Palaszczuk government's policy to mandate the vaccine for a number of hospitality and different venues, of course, visiting our aged care and our hospitals, that this is making a difference and encouraging people to come out and get vaccinated. We know these are difficult decisions, but it is so important that we do what we can to get people coming out and getting vaccinated. We support our businesses. This will support them in keeping their doors open by knowing that they have a lower chance of having an outbreak across their staff, and of course knowing that their patrons are coming in and are fully vaccinated. And for those people who have been vaccinated, it gives them the confidence to go out and enjoy the lifestyle that they've loved so much in Queensland, knowing that the venues they're going into, everyone else is fully vaccinated as well. We also know we are so close to that 70%, and I'm sure everyone's wanting to know what those numbers are today. 81.11% first doses and 69.39%. 69.39%. So we are so close to hitting that 70% double dose, and when we do, it means people from interstate, from hotspots, will be able to start home quarantining if they can arrive by air and meet the criteria that we have outlined. Of course, the big key criteria is fully vaccinated, 2 weeks since their second dose. They must have a negative test before they get on that plane, and they must be able to quarantine in a residence that is a standalone residence or has direct air-to-door access and no common areas to reduce that risk. So if you are interstate, if you have been trying to come back, have a look at that criteria. It's already online. And when we get to that 70% double dose, we will be able to let people know the next steps, but we are so close. And just remember, 70% is not the end goal here. We want to keep going. We need people to keep getting vaccinated. We want to hit that 80% double dose where people will be able to come in by air or by road domestically and not need to quarantine if they're fully vaccinated and have had a negative test. And then, of course, we want to hit 90% and beyond so we can open up and enjoy our lifestyle, but most importantly, to have that high level of protection right across Queensland. So please come out, get tested if you have any symptoms, and keep coming out and getting vaccinated. Thank you to all the families, all of the people in the local community here who are coming out and getting vaccinated. And I also want to acknowledge we've got Dr. Catherine Hester here with us today from the Royal Australian College of GPs because we want to thank our general practitioners who have been on this journey with us, vaccinating many of the community, and it's important that people let their GPs know if they've been vaccinated so that their GPs can let them know when they're ready for their booster shot. So don't forget, Let your GP know if you're vaccinated, and they will let you know when to turn up for that booster shot, which is going to be important as well. I'll now hand over to Dr. Aitken, and then we'll hear from Nikki Boyd and Dr. Hester. Thank you.
Thank you, Minister. And as the Minister said, it's good news today. There are 0 new cases, and that's particularly important for the Gold Coast. There's been an increase in testing. It's over double the testing numbers that have happened at Gold Coast, and with that, there's no new cases. It's important that continues. We're still not out of the woods yet. We've got a long way to go, and we really encourage anyone at Gold Coast and anyone across Queensland, if you've got symptoms, please come forward and get tested. Similarly, come forward and get vaccinated. We're so close to 70%, as the Minister said, but probably the thing I'm more excited about is that we've increased to 81.11% first dose. And that increase in the first dose continues, and that's really important. The closer we can get to 90%, even better. I think the big other message continues, as we have done. Queenslanders, if you're in crowded areas, particularly at the Gold Coast, wear masks. Think about that protecting yourself and your family, but where you can't socially distance, it is still important to wear a mask. If you've got symptoms, come forward and get tested, and please come forward and get vaccinated. Thank you.
Good morning. Our community is such a wonderful place to live, and here at Bray Park High it is one of the beating hearts of the Pine Rivers community. It's wonderful this morning to see so many people gathering, being able to access their vaccinations. We've got a wonderful mix of both first dose and second dose vaccinations happening here today, and a large cohort who are turning out are the young people in our community, which is wonderful. I've got the Principal Peter Turner here with me, who's recognising many students and families who are coming through. Our message is really simple. There's lots of places around the state to be able to access your vaccine. Please get your first shot and your second so we can resume life as usual and enjoy our community. And also, if you're sick or have symptoms, please get tested.
Thank you, and thank you for the community for such a good turn up today with their vaccinations. We know that this is the best way to protect ourselves and to protect our communities from COVID-19. If you've chosen to have your COVID-19 vaccine from somewhere other than your usual GP, remember to let your GP know when you've had this vaccine done, and maybe even bring in your vaccination certificate so that we can make sure that you get your booster dose at the right time. Thank you.
Minister, former New South Wales Premier Bob Carr made some comments yesterday that he said that he would like to see in the future people that aren't vaccinated, that refuse to get vaccinated, whether they catch COVID, should have to pay their medical bills. What's your thoughts on that, being the Health Minister of Queensland?
Oh, look, I'm very proud of the universal health system we have in this country. I think it's one of the shining lights about Australia, that we have a free, available public health system for whoever needs it. We will never, ever turn someone away who turns up at our doors needing health care. It's that simple. And it's a system we should hold dear to our hearts and make sure we maintain and retain into the future. I wouldn't want to see us move away from it.
With some of the other things the unvaccinated won't be able to enjoy, again, moving forward, do you think there is going to be underlying issues here in Queensland? Like, we talk about the 17th, we talk about Christmas, people want to be together, yeah. They might want to go out. I mean, we've talked about the policing. Are you still worried as to what might occur after the 17th?
Look, we know, again, this is difficult decisions, and the police have said that they'll take an educative approach to this, as they have with all of the other initiatives we've put in place, and work with businesses so they're clear on what their responsibilities are and what they can do to encourage their patrons to do the right thing. But the police have said we don't expect businesses to be police or security at the doors. We don't expect them to put themselves in harm's way. We have said the same thing with people checking in with the QR code or wearing masks when they're mandatory. We ask people to be responsible, and we also remember that the obligation's also on the patron, not just the business. You have to comply with these lawful directions. And this is about keeping people safe. These are places where we know outbreaks can happen, that large numbers of people gather in small places, and we know that we're talking about letting businesses operate at full capacity again. And that's important because businesses have done it so tough throughout 2020 and 2021. They deserve to be able to move to operating at full capacity again. But to do that, we need to do it safely, and that's why we're saying that the staff and the customers have to be fully vaccinated. Now, we will review that into the future, but let's get to the 80% fully vaccinated first and beyond, and then we can work out what it looks like going forward into the future.
Do you have any more details on when people will know that we've hit 70%, how they'll pull the relevant border reports out, and do you know if there's any extra planes being put on, for example, with any discussions?
Look, I personally haven't had discussions, but I'm sure there's discussions going on with the airlines. I know the airlines have seen our plan. They know exactly what our plan is. You look at the stats every day, it's pretty easy to work out that we will hit that 70% double vaccinated within the next couple of days, I would think, because we are, about 0.6% away from there. And when you look at how much we've been increasing every day, we are just a matter of days. We set ourselves the 19th of November as the deadline. We will get there before the 19th. So people can start planning on that basis. When we hit 70%, then we will let people know when the border pass system will go up. But remembering, the border pass system is an automatic process once you can comply with the criteria. So when we hit that 70% mark, it'll be important at that stage people can start booking their flights, going off and getting their test and waiting for their negative result. And once they've got all that information, they've got their vaccination status, their negative test and their flights booked, they can go onto the border pass system and they'll be able to put all that in. So we'll be able to tell people when that all goes live, but people will be able to start planning for that based on the fact that we're going to hit that mark in the next couple of days.
As far as those tests, is it they'll go to a local respiratory centre, or are there any saliva tests approved by the TGA?
There's not rapid antigen tests that we're proposing at this stage, just because the accuracy of those are not as good as a PCR test. So we would tell people to go to their normal testing clinics in their areas interstate. There are many available. There's the Commonwealth ones, there's the private ones, and of course there's the public ones run by the public health system. So they can go get their test, and as soon as they get that result and they've got their flights booked and they can meet that criteria, importantly, then they're back in Queensland.
Will those systems, Minister, I guess will all the changes to 70% kick in the next few days, or there's going to be a bit of a lag while the system
We'll talk about them when we hit the 70% mark. But for example, if we hit the 70% mark, we're looking at probably at least 24 hours for the system to go live. That's what we've been told with the Queensland Police Service and everyone to start booking. But remembering, even if we hit 70% tomorrow, people still have to book their flight, they still have to go get their test, and they have to wait for their test result. So they have to have all that in place before they get online, get their border pass anyway.
Sorry, Mr. Deputy Commissioner Palaszczuk was saying yesterday that around 14,000 people, they've been testing the system. Two questions. You would have seen the dummy system set up. Is it ready to operate? The other one would be, when they do get the test, I'm assuming, Minister, that they'll get off the plane, have to show it to the police or someone to say, here's the negative test, here's the passport, move into the bus, or they get into their cars and go.
Yes. So there's a number of areas where we will be able to check. So I'll be very clear to people, if they think that they can rort the system, if you think that you can get a border pass and get on a plane and get off the other end and not be caught, if you haven't done your vaccinations, if you haven't got that negative test, you will be found out, because we have a system where those documents have to be uploaded before you get your border pass, that there will be regular checks as people are getting off flights, and also everyone has to home quarantine and sign up to our check-in system. So we will be able to check that people are complying at home quarantine, and while they're in home quarantine, we'll also be able to check all of those documents again and make sure everything was valid and legitimate. And if at any point we find that someone has not validly applied and provided false information, there will be fines attached to those.
What about Transport, Minister? Will they get off the aeroplane? Are they allowed to get into Ubers and taxis? Does that put them at risk, or they have to get
So
into...
they won't be able to get into Ubers and taxis. There are some government-approved providers. Most of them are in Brisbane, so we understand that's harder in the regions. We're looking at whether other providers can be approved around the state, but it's unlikely many taxi operators will take up that option, because once they're a provider, that's all the work they do. But alternatively, what we're saying, you own private transport. So if someone's able to drop your car off and leave the keys on the hood and wave to you and drive off, and you can get in your car and drive off, someone can come.
Some of the complexities.
Someone can come pick you up. Who many people who did the 1,000 people trial were quarantining with other people in their household. So someone who you're going to be quarantining with can come pick you up and take you back as well.
Does that person also have to quarantine them to pick you up?
Yes, because that's what I'm saying. There's many households where the people in the household have already agreed, as part of the arrangements, that they will quarantine with their loved ones who are coming back. And if you're going to be quarantining with them, then you are certainly able to go and pick them up from the airport and bring them back to the residence in which they're all going to be
They'll
quarantining.
be involved in that quarantining process. So that means the police come around, they go, well, where's Joe Smith who picked you up, and they're not there?
That's
You're in
right,
trouble.
because if you have to, when you get your border pass, talk about where you're quarantining and whether other people will be quarantining with you, and so the police will be able to check whether those people are also home when they do any spot checks.
The message would be patient, wouldn't it, to people coming in?
Yeah, look, be patient. We understand people will be wanting to get on flights quickly and come back. There is no cap. So, when you can comply, if you can meet all that criteria, the border pass will be automatic. So you won't have to wait, 1, 2, 3 days to get that approval. You tick all those boxes, your border pass will be provided, you'll be eligible to get on that plane. So it will be a quick process, but you've got to make sure that you have all of that criteria in place, and there will be checks on those documents, there will be checks at the airports, and there'll be checks while you're home quarantining.
Minister, what's the state government doing to crack down on not only people who are fraudulently obtaining a vaccine passport, but also potentially GPs who are issuing them against the law?
Oh, look, there's lots of avenues. Obviously, if someone is breaching a public health direction, that's an offence. There's penalties to that. But also, if they're committing fraud, that could be a criminal offence. These are matters that, if anyone's aware of these circumstances, police follow that up, investigate, and if need be, lay charges or issue fines. I mean, if a GP is doing something that is illegal, then of course there's consequences to that, as far as their registration to practice, but also whether they're committing any criminal offences.
Is there work behind the scenes to try and assess if this is happening quite frequently around the state?
Look, we certainly haven't seen evidence that there's broad fraud happening in this space. We hope that people are doing the right thing. The entire system from day one across the country is based on trust of people doing the right thing, but remembering that it's not just trust, because we have many checking systems along the way that we will be able to find out whether you actually do have vaccination. If people provide a fraudulent vaccination document, we have direct access to the Australian Immunisation Register. We will be able to immediately cross-check it and find out whether someone has validly had both vaccinations.
You'll turn them around, Minister?
Absolutely. If someone turns up at an airport and they do not have the proper pass, or they haven't met the criteria, they will either go into hotel quarantine or they'll be turned around.
So, Dr. Aiken, can I just ask, if I could, I mean, there's obviously this is going to be a massive process. There's a lot of people that are going to be coming in from these, COVID-infected areas. What's some of, the planning on your behalf? I mean, hospital staff and things like that, have they been told that to get ready for a possible outbreak?
Yes, is the answer, and there's lots of planning being done, and we are anticipating both at 70% and 80% and beyond that we inevitably will get cases of COVID throughout the Queensland community, and the HHS's, primary health networks, primary health sector, everyone's ready for that, and it's important that everyone's ready in terms of monitoring, compliance, following up test results, and then being able to identify those people quickly, make sure the community is protected, and make sure they get access to the care they need.
You can't see your advice to the Premier and to the Health Minister changing on that December 17 opening the borders. Say, let's say, for instance, we're standing here a week from today and we've got 100 cases. Do you see your advice changing for the 17th of December?
No, at this stage we'll continue with the planning we've done, and the planning we've done is based on 80% at 17 December, on whether we've got 0 cases, whether we've got 100 cases, God forbid, whether we've got 500 cases, and we'll use those plans and those arrangements, and that'll continue.
Dr. Adrian, can't you get a medical reason why quarantine can be dropped at 80% for domestic travellers but has to remain in place until 90% for international travellers?
A lot of that is due to a couple of reasons. One is simply that there still is concern about emerging strains from overseas and the vaccination requirements and making sure that is all in place. The other thing is simply to protect the Queensland community, and we're trying to make sure that as we open up our borders that we can manage that flow and make sure the health system doesn't get overwhelmed. I'm very confident that won't happen, but this is a staged approach to make sure that we have our domestic arrivals first, and particularly Queenslanders, Australians, coming back into Queensland, and then international arrivals after that.
There's been a lot of discussion about the fact that Doherty modelling says that international quarantine can be dropped at 80%. What is it about that modelling that you don't agree with?
I don't think it's that we don't agree with the Doherty modelling. I think it's about managing the demand and keeping our community safe, and that's an approach that other jurisdictions have done the same thing. Western Australia, South Australia have got very similar approaches to us, and I think we're in a different position than New South Wales and Victoria that have reached that 80% already.
So is it about managing our peak and hospital system?
That's completely part of it, and it's important that we do manage our hospital capacity and make sure that we manage COVID, we can manage the people who have COVID, but importantly we can also continue to provide essential health care to the rest of the Queensland community, and we've continued to do that throughout. There's been an incredibly fortunate position.
Do you worry the hospital system wouldn't cope if there was not quarantine until 90%?
No, we would cope. There's no doubt about that. It's about making sure that the numbers of COVID cases are able to be managed and we don't put our community at risk.
Are contact tracers any closer to working out how the 2 Gold Coast cases will apply?
At this stage there's no defined link, but the close contacts have all been followed up and they're in the process of being tested, and all test results at this stage are negative.
Dr. Aiken, you said we're not able to get with that Gold Coast cases. You also mentioned anyone in crowded spaces around there should have their masks on. What else is the message for people there? Is this still a concern for you?
It is still a concern. We're only a couple of days after that, and we'd obviously like to get through a full 14-day incubation period. Until that happens, we just continue to do the same thing. If you're in crowded places in the Gold Coast and you can't socially distance, we would encourage you to wear a mask. Importantly, if you've got symptoms, come forward and get tested. So we need to identify anyone who may have been exposed, get tested, we'll find those people, and importantly get vaccinated as well if you haven't been already.
Dr. Aiken, I know you briefly touched on this, but if something does, I guess, explode, for want of a better word, with COVID on the Gold Coast, does that have any bearing on, I guess, borders opening, anything like that, or your advice for that?
I think that's a hypothetical situation. We'll cross that bridge and hopefully we don't have to even think about that. And we're on track at the moment to get on top of the Gold Coast.
Minister, can I actually ask what's in place as well to stop people visiting people in home quarantine?
Oh, it's the same as we have all along. Remember, we've had tens of thousands of people in home quarantine since the start of COVID last year, and at one point I think we had over 30,000 people in home quarantine. So this is not new to people. Everyone understands the risk. Everyone understands that by allowing someone to come into your home, you are putting those people at risk. They may then go out into the community and unintentionally spread the virus. So it is a breach of the directive if you allow someone to come into your home, and if compliance officers or police become aware of that, then they can issue penalties. I do just want to touch on the difference between international arrivals and domestic as far as quarantining as well. You have to remember that again, at this stage, people are still undertaking PCR tests in Australia. We know they are far more accurate than some other tests. Now, I got some data put together yesterday, and since the directive came in nationally, that international arrivals have to have a negative test before they get on that plane. We've had around 420 people arrive in Queensland this year who have been positive after they arrived. So despite getting on that plane negative, they have been positive either immediately, and we've had, I think, 2 cases this week where they were positive on day 0 and day 1. That means they were infectious on the plane, on arrival. So, you know, we appreciate the people having tests before they get on those planes, but those tests aren't always at the same level of accuracy as what we have here in Australia. And so there is a increased risk of people arriving internationally and going straight out into the community and spreading the virus.
Can we expect an announcement on the full-time chief health officer shortly as well?
Yes, I don't have a particular time. The panel's meeting to consider the applicants that were already interviewed previously, and they will make a recommendation in the near future. Is that it? Thank you.